As we begin this course called What's Different About Working in Healthcare Facilities, it's critical for you to understand that your actions will have a positive or negative impact on patient care. It doesn't matter what type of work you'll perform, but what does matter is that you have the knowledge and training necessary to work in a healthcare environment. Patient satisfaction has always been important in healthcare, but it took on a whole new meaning with the introduction of HCAS in 2006. HCAS is an acronym for the Hospital Consumer Assessment of Healthcare Providers and Systems. The survey has 11 dimensions. 2 of these dimensions are cleanliness and quietness of the hospital environment. The scores from patient surveys and the Affordable Care Act result in pay for performance for healthcare providers. A PETRA is designed to protect against patients from construction risks by assessing noise, vibrations, air quality, interim life safety, infection control, emergency procedures, and utility failure. The PETRA will require that dust-producing projects must be performed behind negative pressure dust containment structures. The movement of debris during construction increases the risk of infection exposure to patients in a healthcare facility. A PETRA will specify how debris should be moved and when it should be moved. Healthcare officials are aware that a certain level of noise and vibration are unavoidable. However, it is the responsibility of you and your employer to discuss these actions prior to the project so that everyone involved can address ways to minimize noise and vibration, and even more specifically, the best time to perform that part of the work. The single most unique element of a PETRA is the ICRA, or Infection Control Risk Assessment. Healthcare-associated infections are called HCAS, and here is what you need to know about them. Healthcare-associated infections are either fungal, bacterial, or viral infections. Sometimes patients even die as a result of an infection they acquire at the hospital. A staggering 2 million patients acquire healthcare-associated infections each year. Even more amazing, of those 2 million patients, approximately 70,000 will die. Here's another example. A worker rolls an air scrubber or compressor into the facility from the street or loading dock without sanitizing the wheels. That person is transporting potential contamination into the healthcare environment. Metal items like hand tools, ink pens, watches, keys, belt buckles, coins, and earrings brought into an MRI room will become magnetized. They can also become airborne at such a high speed that they penetrate the MRI machine. As a final thought, we would like to place emphasis on the following. When your employer is awarded a work project in a healthcare facility, the healthcare staff will have certain expectations of you and your fellow team members. This training, as part of the series of Priority 1 programs for physical environment workers, will provide you with the knowledge to better understand the many unique aspects of working in healthcare.